So today I'm going to be going over 5 exercises that you can do after a total hip replacement. Now these exercises are important in terms of regaining your strength and your range of motion back after the surgery as a rehab tool, but they can also be used as a prehab tool. So if you find that you're going to have surgery in the next upcoming months, doing some of these exercises will help to optimize your recovery and understand some expectations going into the surgery so that your recovery can be expedited when you do have the surgery and afterwards. It's important to note that before we go over the exercises, there are some different approaches that the surgeon can use based off of their experience and their expertise in which areas. There's the anterior approach where they go through the front, and then there's the posterior lateral approach where they go from behind / out to the side. Why is this important to you and what does this mean? Well, sometimes if they go from the back, there are some restrictions that can be put in after the surgery in terms of what movements you can't do. Particularly, most surgeons may state things like no hip bending more than 90 degrees, which means no bringing your knee above the level of your hip, and also abduction, so bringing your leg out to the side, or they may say abduction as tolerated, and then some will say no adduction, crossing over the midline, so no crossing your legs or bringing your knee past that imaginary center point in between your legs. So exercise number 1, we're going to do some active assisted knee and hip flexion. So this is super important to do after surgery, as working on that range of motion can be quite challenging, especially right after the surgery. So what this is going to look like is you're going to grab a strap from your robe or a band, just something that gives you a little bit of assistance. And what you're trying to do is try to bring your heel towards your bum. And notice that as I'm bringing my heel towards my bum, my knee is bending, but my hip is bending as well. Okay, so this is going to be super important. This is exercise 1. And again, you're not going to be able to do much at the beginning, but as you get stronger and swelling decreases, inflammation decreases, you'll be able to slowly start to build on that range of motion. Exercise number 2 is going to be isometric hamstring. So what that means is you're going to try to think about pushing your heel into the bed. And as you push your heel into the bed, you're getting that muscle activation in the hamstring muscle, which again is going to be really important after surgery to regain that function. The nice thing about isometrics is that you can push down as hard or as light as you feel comfortable with based on your level of symptoms and just how provocative it is at that time. So you're trying to push down, hold for 5 seconds, and relax. Exercise number 3, we're going to do active range of motion for hip internal rotation and external rotation. So what this is going to look like is you're going to lie on your back, okay? And I'm just thinking about rolling my hip out and then rolling my hip in. So this is just a very simple, basic exercise, very low load, using gravity to your advantage by helping with that external rotation and going back in, helping with some of the inflammation, some of the swelling. This is an exercise, so our hip generally rests in about 30 degrees of external rotation because this is the position that feels most comfortable for our hip joint. So generally we'll be in this position as is, or this position feels more comfortable, but actually moving to the opposite spectrum is helping to get a little bit more blood flow going and helping it to feel a bit better. Exercise number 4, what we're going to do is we're going to grab a foam roller. We're going to do a quads over roll. So what this is going to look like is you're pushing the back of your knee into a roller or a rolled up towel, anything that's a few inches off the ground or off the bed, and you're trying to straighten your knees. So you're lifting your heel up, straightening your knees. So this exercise can be quite challenging and quite sore, but super important that you try to work on it to get that activation in this quadricep muscle. So push down, back of your knee, turn on this muscle and try to lift that heel up in the air. Come back down. Okay, try to hold it for 5 seconds and relax. Okay, so that's exercise 4. Exercise 5, so last exercise we're going to work on is just abduction. So here, again, I'm lying down and I'm just trying to bring my leg out to the side, making sure my toes are pointing in the air the whole time. I'm not just rotating outwards. This is a pure abduction movement. You could put a plastic bag or one of those heel sliders to help make it slide easier. But again, just trying to work on getting some muscle activation on the muscles on the outside of your hip. So there you have it. 5 exercises that you can work on as both a rehab tool after your hip replacement and as a prehab tool if a hip replacement is in the near future or you are scheduled. Now again, make sure you're respecting the orthopedic surgeon's restrictions that they have put after the surgery so that you're not doing some of these exercises if they're not allowed to do. But those are generally some of the most common exercises done after a total hip replacement. As these exercises get a little bit easier, the goal would be that you progress from exercises lying on your back, so in a non-weight bearing position, to a weight bearing position. So exercise in standing, like mini squats or lunges or things like that to kind of load the tissues up a little bit more. Obviously working on your walking pattern as well with your walker or cane if you're using one at the beginning. But this is a good kind of foundation and then build from there. So went over 5 exercises. If you have any questions, comments, or concerns, please leave them down below. If you've had a total hip replacement or are planning to have one in the future, let me know down in the comment section and tell me how your journey has been. Until next time, we'll see you in the next video. Thanks for watching.